Morning. Morning, everyone. I hope you're all good. Looks as if Martin's in, but he's very cold, or the screen is freezing. Um, hopefully, well, I'll say hopefully. Um, yeah, fingers crossed. It's not a technical error, and it's just a temperature one. Looks as if that's all good. Morning, Penny. Morning. Good. Got a few of you in. Right then, we'll get going. Yeah, last week we looked at the sacrum and the osteology, so all of the bony landmarks, and then we started to layer on some of the ligaments as well. And yeah, I was on the verge of a constant sneeze, and turned out had COVID. Yeah, feel a lot better today, thank God. Wiped out my whole week last week. Never mind, it's still around and with us. Okay, Tristan's favourite session. Yeah, I remember hearing you say that for the first time last time we covered this. Right then, let's get you going. So we're going to finish off where we were last week, having a look at the ligaments of the sacrum, and then finishing all that off. So let's just get rid of that. So this is where we're at. Put my arrow there. So we had a look at these ligaments. We're going to have a look at these again in a bit more detail as we started to layer on some of the pelvic floor muscles as well. So yeah, you'll see it from a different couple of views today. Some of the key bits then. So this is the front of the pelvis. This is the right side. Again, we covered this last week. So just a quick recap. That's your lumbar spine. There's your sacrum just there, and then the coccyx at the bottom. And we talked about the anomalies around this area, that sometimes you can have a sacralized lumbar or a lumbarized sacrum, and the frequency of those as well, and how common it is to have those kind of variations. And then we started to look at as well some of the differences in the coccyx and in the sacroiliac joint, and the frequency of those changes as well. And they're surprisingly high. They're a kind of normal sacrum and a normal sacroiliac joint is around about kind of 75-80% of the population. So there will be 2 in 10 that you see. Obviously there's confounding factors as well. Some people might have 1, some people might have 2. So it's going to be fairly frequent that we'll see these. So again, it kind of throws into question some of the movement tests that we do around the sacroiliac joint, and then that doesn't even cover all of the bony anomalies and the differences from side to side in terms of landmarks. So PSIS is being bigger on one side, and ASIS is being bigger. The height of the iliac crest being bigger on one side than the other. So there's quite a bit of variation in and around this region. So we have to take that into consideration when we're doing some of the movement screening that you see. This then we started to get onto these. So this is the anterior longitudinal ligament. It's anterior at the front, longitudinal, really long. It goes all the way to the skull, and wraps around the whole of the front of the vertebra, attaches to the discs and to the vertebral bodies, and obviously doesn't look like this. Well, I say obviously, if you don't know, it doesn't look like this. This has been shown to have a cut on the side here, so it exposes the vertebra, so you can see the location of it. But literally, it just like covers everything. It just wraps around the whole thing. And then same with this as well, the anterior sacroiliac ligament as well. And then we've got these here. So we've got the sacrospinous ligament. So there's your sacrum. That little projection there is the ischial spine. So the ligament between there is the sacrospinous. And then we've got sacrotuberous. So this one here, right at the back. that goes from your sacrum onto your ischial tuberosity. So that's why it's sacrotuberous. And the crisscross and attachment of these ligaments create these holes, which are the foramen, the greater and lesser sciatic notches, which then create a foramen where um, uh, muscles and nerves will pass through, and it kind of creates different sections. Okay, so yeah, so that's quite a cool picture. And then this is a view from the back. So we've got a hamstring tendon coming in here. This is the ischial tuberosity, and then your iliac crest on the side here, ischial spine just there, so that little projection there. And again, we've covered all these before, so if this is a bit quick, then go back a few episodes to bony landmarks of the hip and pelvis, and we go through all of these. Then this here is your sacrotuberous ligament, and then we've got the posterior sacroiliac ligament as well. And then up here, right up here, that this was a classic when I was training, iliolumbar ligament sprain. Everything was an iliolumbar ligament sprain if they had pain around this area here. And to sprain a ligament, it's got to be stretched. And if think about where that attaches from there to there ain't much movement there. I think you've probably got to be in a what is the one that are hiding? Oh, there we go. Is that me out the way? Sorry, Penny. What is the one you are hiding behind you? Yeah, so but I think that's that one. Iliolumbar ligament just there. Yeah, so that's it from a back view. Yeah, so you've got to stretch a ligament to sprain it. And I don't know. I mean, how the hell are you going to get a kind of side bend enough to create a sprain in that ligament? I don't know. Basically, we were trying to come up with a mechanical cause for pain in this area, and that's probably an unrealistic one. There we go. Right, so yeah, so this was another view, and so this time on the inside of the pelvis. So again, a right side. They've taken off the left, and you're looking at the inside of a right innominate bone. So there's your iliac crest, there's your ASIS, there's your AIIS, pubic symphysis at the front, and then we've got this obturator membrane. So this is the obturator foramen. Just at the top there, you've got a little gap, which is where the blood supply and the nerves will go through. So the obturator nerve and the obturator vessels. And then, yeah, there's your sacrotuberous ligament, and there's your sacrospinous just there. And then that's part of the anterior sacroiliac ligaments just there. Cool. So that was a quick recap. Let's have a look at some of those. Bear with me a sec. I need that one and that one. Let's get rid of those. Hopefully this will play. No. Oh, it's playing down here. Okay. Get rid of that. Where are they gone? Sorry, bear with me a second. It's going to come up. I'm sure we had the videos all queued up. Never mind. Okay, bear with me a sec. Let's go through the rest of this one. Yeah. So again, another view of the of all the ligaments around the pelvis. In fact, yeah. Let me show you this one. Just remembered where it is. It is. There it is. Let's get that one on. And that one. Okay, just going to get rid of some of those. So a preview of things to come. Yeah, I think this is going to be it. Yeah, perfect. So yeah, let's have a look. So this is the same view as, just go back one, that. Okay, so inside of the right pelvis, and then there, inside of a right pelvis. Okay, so there's the obturator foramen. There's your ischial spine. This is your ischial tuberosity. Pubic symphysis just here, so your pubic tubercle at the front. There's your lumbar vertebra, so L5 going into the sacrum and then into the coccyx just there. Okay, cool. So there's your orientation. Let's just have a look at this as we start to layer some things on. That's quite a nice one actually. So you can see the hiatus down the back there, so where the spinal nerves will go, and there we go. Okay, so that there is your anterior sacroiliac ligaments, and as I said, it's kind of like I mentioned Spider-Man quite a bit in my teaching, but it was Spider-Man just shooting his spider web, and it just goes squonk, and it just covers everything. That's basically what it looks like. So it just, and it's everywhere. And so when you look at the images in the trail guide book, you see it's all nicely separated, and you can tell which bit's which. That's what it looks like, and you can't tell at all. When you dissect areas like this, you kind of go with the flow of it. So you tend not to use a scalpel. You do what's called a blunt dissection with your fingers, so you obviously get some gloves on, and you'll follow the line of stuff, and there'll be a natural kind of separation, and that's basically what we do. And then we go, okay, that bit's probably to do with that bit over there, and this bit's probably to do with that bit over there. So we try to separate things out along where they naturally occur rather than cutting through. But that's basically what they'll look like. But with ligamentous tissue, it's really, really hard to blunt dissect because it's so tough. There's your sacroiliac ligaments at the back. So huge, huge ligaments again, and just filling this sulcus space at the back here. So your sacroiliac joint will be at the back there somewhere. And then here we go. So now we're starting to get into your sacrotuberous ligament. So there's your ischial tuberosity just there. Sacrotuberous ligament all the way up here. Okay, and you can see with that, even there, it's starting to create these two apertures, these two or foramen, these two openings. Okay, so look there, and then there'll be another one across here in a sec. So there's your sacrotuberous ligament, and in anatomy trains terms, that's the connection on the posterior back line with your hamstring. Okay, but again, like I said, when you're dissecting stuff, you can create whatever anatomy train you want. Yeah, so if you wanted to connect your hamstrings into the opposite QL, you could find a way to do that and go, oh yeah, that's the way that they work together. So the anatomy trains has been criticised quite a bit for the way that it was put together like that. Okay, and then there we go. So this is an inside view. There's your ischial tuberosity. And then coming across there. There we go. That's the one I was waiting for. So there's your sacrospinous ligament just there. So there's your ischial spine going onto the sacrum, which is just here. There's the tuberosity going onto the sacrum there. So that's your sacrotuberous ligament there. And there's your sacrospinous ligament just there. And then it creates this opening here. So this is where the greater sciatic notch is. And so that one there. And then that's the lesser sciatic notch just down here. Okay, so those are the two separations around that area. And all of this forms the walls of the pelvic brim. Okay, so the pelvic floor. So the ligaments there are kind of like a supportive mechanism for when the muscles are layered on. So that, yeah, there's your sacrospinous attachments. There you go. And like I said before, the ligaments create the foramen, which are the openings. So that's the greater sciatic and then the lesser sciatic just there. Just move the arrow out of the way. Okay, so there's now we're joining the two together. So this is the opening at the pelvic floor. So obviously there's no muscles here. and there is one other ligament attaching to the coccyx, but other than that, this whole area is supported basically by musculature. So as we start to add on the muscle layers in a second, this hole here will just fill in with musculature, which then supports all of the pelvic organs. So the urethra, the vagina, obviously in females, and then the anus and the rectum as well, obviously for both. And you'll then everything around those openings will be surrounded by muscle tissue. Okay, so the sacrotuberous ligaments joining in to the sacrum on both sides, and then that's what creates this this opening at the bottom here, and it looks like a circle shape. If I just so that's your inferior pelvic aperture, so opening of the bottom part of your pelvis. This here, so this word here, ischiopubic ramus. So ischio is to do with your ischium, so that's your sit bones, so that's here, and then pubic is obviously your pubic bone around the front, and a ramus is a branch. So this area here is the branch between your ischium and your pubis. Okay, so that's what that bone just in there is. So you've got a mixture of bony connections, cartilaginous tissue here, so this is your pubic symphysis, and then ligamentous tissue here, so this is your sacrotuberous ligament, and then into here, which is the coccyx and the sacrum. Okay, so it's a mixture of all of those structures that create the integrity of the pelvic floor. So that, like I say, it looks like a circle, but actually when you turn it, it's curved. Okay, so it's not flat. There's a curve to it, and the muscles. So it's like a hammock, basically, when the muscles are in place. So that's it from the side, just there. So there's your ischial tuberosity, acetabulum there for your hip, and this is a view from the top. So again, we can see it looks like a circular gap, but we know it's curved. And we're going to start to add some of the tissue in around this area in a second. Okay. Cool. All right with that? Good. Right. Okay. So that hopefully makes this one make sense. And then also, if I just move forward, makes this one make a bit more sense as well. So there's your sacrospinous, there's your sacrotuberous ligaments just there. And then this will be your opening here, the pelvic inlet. And then, yeah, we'll cover these when we get onto the lumbar spine, because you'll be able to see those a lot better on that. So you've got posterior longitudinal ligament, so another ligament that's on the back of the sacrum. So here's your sacrum just here. There's your lumbar vertebra there. And this is now a view from the back. Okay, so this is a posterior view. There's your coccyx down the bottom there, and what we've got is this ligament that travels all the way up again, all the way up but it's on the inside of the spinal column. Okay, so you'll have your so if we have a look here, so and this is where it becomes a little bit easier to see on the lumbars. So that's your lumbar vertebra just there, and you've got a little bit of change in shape here and here, and that's because the back of the vertebra have been chopped off. Okay, so you've got these little legs on the side of the lumbar vertebra. They've been chopped off, so you can see the back of the vertebral bodies, and that's where this goes. Okay, so it goes on the back of the bodies of the lumbar vertebra, and it also attaches onto your discs. So you can see that there. Obviously not the case in the sacrum. We don't have discs in the sacrum like you do in the lumbars and further up. So the really cool thing with this is in this region here, you've got your vertebral body, then you've got the posterior longitudinal ligament, and then on top of that, you'll have your spinal nerves. So if there is a problem with the disc, then the nerves are protected by this ligament. And one of the reasons why we have disc bulges that go backwards and then to the side, so what we call posterior lateral, is because of this ligament. So if you have a look, there's a disc there and there. So if that disc is going to herniate, it won't herniate centrally, or it's very unlikely to. It's just less likely to. It's more likely to come out the sides here and here, okay, because of this ligament. So it pushes it away from the central part of the spinal cord, okay, which kind of makes sense. Keep it away from that important area. And then we've got, so even more ligaments on the back. We've got interosseous sacroiliac ligaments as well. So these are really deep. Okay, but you'll never be able to separate these out or see them. And then we've got the thoracolumbar fascia, which again we'll cover when we get into the lumbar spine. So just a bit of an introduction. So that this then connects, so another layer of connective tissue over the sacrum, which then connects into your lats and then up into the shoulder. Okay, and it crosses over and connects with the glutes on the opposite side. And again, this is a classic kind of myofascial sling system. Okay, we've been talked about for like 30, 40 years, maybe even more than that. Certainly popularized in the last 20, where this opposite glute works with the opposite lat dorsi. But my point with this is you've got over the, and I've said this a few times, over the sacroiliac joints, you've got interosseous ligaments, posterior sacroiliac ligaments, then you've got thoracolumbar fascia, then you've got adipose tissue, so fat, subcutaneous fat, and then you've got the skin. Okay, so you've got all of these layers over the top of the joint. So there is impossible to feel that joint. That there's so and also it doesn't move very much either. So being able to detect something quite minute with all of this connective tissue over the top of it is I would say is impossible, and the research says it's impossible as well. Cool. So those are your ligaments, and then I just want to bring in this. So some of the bits we've already seen. So that this is the kind of greater pelvis, if you like. It's not really the pelvis. This opening here and the other aperture that we saw previously, those are the two pelvic inlets and outlets. Okay, so the greater pelvis, the kind of brim of the whole of the pelvic region, is actually your false pelvis. Okay, so it's it's this bit that would be considered the true pelvis. Here we go. The lesser pelvis, the true pelvis, is this region here. Okay, so it's the smallest, the narrowest opening at the top of that video that we just saw. So you've got the anterior part of the sacrum forms the back of the pelvic wall, and then the inside of the ilium, the iliac crest, they form the walls of the pelvic wall, and then the bottom of it, as you saw before, is just a big opening. There's no bony attachments anywhere around there, or any bony structures around there. Everything is supported by connective tissue and muscle tissue, which is what we'll see in a second. Okay, so one of the muscles that we will be looking at is this one, the levator ani. So there's your sacrum at the back, and that is the other ligament that I was talking about. So I think it's called something like anococcygeus, something like that, which makes sense because of where it attaches from and to. And then that tendinous strip there is where the muscle tissue then attaches, and there are different sections of the levator ani, so that it's split into different parts. So we've got the origin on the ischial spine, so that's this bit just here, and we'll have a look at a video of this in a sec. The tendinous arch, so that's this bit here. So there's a connection on the inside of the pelvic wall, which again is like an anchor point for the muscles to attach to. And then we've got the pubic bone at the front as well. Okay, so pubis just there. Insertion on the coccyx. So we've got the coccyx just there. Yeah, there we go. Anococcygeal ligament. Okay, so that area just there. And then prostate or vagina, obviously depending on the sex. So that is your levator ani muscle. So let's have a look at that in a bit more detail. In fact, before we do that, let's go to this one first. So this kind of gives us a bit of an overview of everything. Bear with me a second. Let me just put, oh, there I am. Wonder what happened to my camera. What we've got here then, so this is a posterior view of the pelvic floor, and the previous video that we saw didn't have any of this stuff. Okay, remember everything was open and it was that circle. There's your sacrotuberous ligament, there's your ischial tuberosity, sacrotuberous ligament, and then there's your coccyx sacrum at the top there. So exactly the same view that we had last time, but now we've got some layers of connective tissue. So this is some of the stuff that we're used to. So looking at the gross musculature, and then we're going to start to move into the more around the pelvic floor. So that there is the anus. There's your anococcygeal ligament just there. So yeah, that area there, let me just go back there a sec. So this ischiorectal fossa. So a fossa is a dip or a shallow. And can you see that there's a bit of a dip here? So there's your ischial tuberosity. And then we've got this dip, yeah, dips in. Nobody's backside does that. So your body is filled here with fat. Let's have a look. And there it is. Okay, so all of that area, that ischiorectal fossa is under there. Okay, and there's your anus just there. So this is exactly the same view, but now we've had all of the external layers put on. So this is the kind of stuff that we're used to. So you should hopefully recognize that muscle just there. That's your piriformis. And then that looks like a quadratus femoris just there. These look like your glute medius muscles. Glute min will be underneath there as well. And then there's the bottom of the sacrum just there. Okay, so that give you a bit of an orientation as to where we are. But that area that we just saw, if I just go back, so that area there, yeah, it's just basically it's filled with fat, just like that. Okay. Nice bit of cushioning. There we go. You get a nice knitting needle in there. And then, yeah, there's your sacrotuberous ligaments. The ischial tuberosity, so your sit bones are just here. Yeah, piriformis just there. Obturator internus there, so that's the tendon of it there. Gemelli muscles, quadratus femoris. And then there we go. There's your sciatic nerve. Look at that. That's a nice one, actually. Forgotten how good this video was. So there's your piriformis. There's the sciatic nerve coming through, just there and there. Obviously, we can see all this. So there's something that's missing still, which we'll have a look at in a sec, which will cover everything. There's your glute medius. So your hamstring muscles attaching in. And then, yeah, there's the cut edge of the one that's missing. Your glute max. There you go. Okay, so that's what's underneath glute max. And then you've got that ischiorectal area just inside the glute max. Okay, so let's have a look at this as well. So these are the, this is the kind of structure of the pelvic floor. So the sides and walls are these areas here. So there's your ilium, pubis. Hopefully this will all be quite self-explanatory now. Seen it a few times. There's the ischial spine. So this is nice and smooth. changes shape then into the acetabulum on the lateral surface, so where your hip goes. Body of your ischium just there. So all of that area there form the walls. There's your bum bones, so your ischial tuberosity, your sit bones, ischial spine just there. Okay, so all the things that we've just been looking at. Obturator foramen just there, and then there'll be a membrane that fills that. There we go, there it is. Okay, I'm just going to pause that there. So this is very similar to the one that we just saw, where we had a look at the ligamentous structures on the anterior sacroiliac joint, but there's no sacrotuberous or sacrospinous ligaments just here. So that's your obturator membrane. There'll be a little gap at the top, which is where the vessels and the nerves go through. But it's not just an open hole, it's full of connective tissue. And again, it forms attachment points for some of the other pelvic floor muscles, something for it to grab hold of. And there's your ischiopubic ramus. So remember I said the ramus was the branch? So it's the branch here between your ischium and your pubis, and then the pubic symphysis at the front. Small pubic arch, this must be a male pelvis. And then the ischiopubic ramus slopes backwards. So that's that kind of hammock shape, yeah, that we looked at before. So here's your male pelvis, here's the female. So we can see that the opening at the top is much bigger on the female, a lot wider, a lot deeper. So this is the true pelvis. And then a wider pubic arch, narrow pubic arch just here. And then again, a wider opening in the female than compared to the male. So that's the differences between the two bony structures. And then this is now some of the tissue added onto it. So we'll start to see the some of the levator ani attachment areas now. Okay, so these are the ligaments that we saw before. So sacrospinous, sacrotuberous. There's your piriformis, just coming through there. So that's the front part of your sacrum, anterior sacrum just there. Pubic bone just here. Obturator membrane here. There you go, and there's a little gap at the top, you should be able to see. There we go, so there's your obturator internus. Okay, and this now we're starting to build up the layers of the pelvic floor. So your obturator internus is a hip rotator, so it travels through here, and oh, here we go. Just move me out of the way. Yeah, so it travels underneath the ischial spine, so just there. It's a bit weird because it's a flipped image, but there's your ischial spine just there. There's your sacrotuberous ligament just there. So that there is your lesser sciatic notch, which is this bit here. Okay, so the tendon of it then goes through there, so you can see it going through. Kind of away from the picture, and then that will attach onto the greater trochanter. I'm not sure whether there is a greater trochanter in this video. Let's have a look. So as we flip it around, yeah, so there's all the attachment points. So it attaches to the obturator membrane, all of that area there, and then flips through, and then there it is there, and then it attaches onto the greater trochanter. Yeah, they've removed the where it would. Piriformis attaches into the same place, or pretty similar place. Okay, there you go, just on there on the trochanter. Okay, so that obturator internus helps provide some structure for some of the other pelvic floor muscles, because what's going to happen here, there's going to be some connective tissue laid over the top of this. There it is. And then so it's completely covered by fascia. So we've got these layers of muscle and then fascia, and then this is the tendinous arch. So this is the thickest part of it, which is where the levator ani then attaches into. Okay, so you can see how close those structures are. So if we just go back to this, so that was this bit here. Okay, so that's the tendinous arch there. So the there'll be obviously with this image, everything else has been removed, so that bit there will be filled with connective tissue. Okay, and then the levator ani will attach onto that tendinous arch just there. Just checking time, making sure we're good for time. Okay, so let's have a look at this one. So again, another orientation. So this is the pelvic brim and the walls. I think we might have already seen this one. Is it the same one? No, it breaks it down a little bit more. Yeah, so this just goes over the brim and the walls again. Inside of the wall, just here. So that's what we've just seen. So we've seen the obturator membrane, obturator internus, and then the fascia that lies over the top will fill this area here. Okay, so again, all of this forms the wall, side walls of your pelvic floor. This bit here forms the back wall. Okay, so the sacrum and the coccyx. You can see the different angles of those. So again, it wasn't just a circle opening, it was a curved shape at the front and the back. And then, yeah, the pubis is in line with the lower sacrum. Right, cool. So that's that one. Here we go. I think it's that one that we saw. Yes, here we go. In fact, before we do that, let's just introduce you to the next one. So levator ani, 3 sections, which we'll have a look at in a second. Attached to this anococcygeus ligament at the back, attached to the tendinous arch on the side, so that connective tissue. And then we also have coccygeus. Okay, so coccygeus is another muscle, attaches onto your ischial spine, just here, and then onto the anterior part of the sacrum, but also on a bit of the coccyx, hence the name coccygeus. So this muscle, the only role it has, you know, normally muscles attach obviously bone to bone via their tendons, and then when they contract, they elicit some kind of movement. This one here is purely there for support. Okay, because it can't move anything that it's attached to. You may possibly get some movement out of the coccyx, but it's going to be minuscule. But its main role is support. So let's have a look at that. Here we go. So there's your coccygeus muscle. Let me just pause that there. And I go, oh, there it is, as if it's easy to see. It isn't easy to see. It's absolutely covered in connective tissue and looks like everything else around it. And this is what I mean. So if we were to dissect this area, what you'd have to do is blunt dissect it with your hands and just peel layers apart to see where the obvious divides were. Okay, so that's that area there. So there's your coccyx, there's your sacrum. Yeah, so it doesn't have a gross motor function. It's there mainly as a support for the hammock. And then there's your levator ani added on to the picture. If I just pause that there. So this is a good view, actually. You can see the tendinous arch here. Yeah, can you see that there? So underneath levator ani is where your obturator internus will be. I realise there's a lot of really long names with this one. If you, again, think about what the words mean. Levator ani elevates your anus. That's basically what it does. Okay, so it's that's its role. And that, like I say, it's split into 3 parts, but it all just looks exactly the same. Okay. So yeah, there's your pubic bone, tendinous arch, ischial spine will be around there, coccygeus around here, the coccygeus muscle. So there's the tendinous arch, and then the levator ani then attaches into that. And there it is there. Okay, so that, yeah, the muscles fibers attached to the opposite levator ani. So obviously this is half of the pelvis. We'll see the other half. There we go. So if you imagine the other side, there's the ischiorectal fossa, which was full of fat from earlier, sacrotuberous ligaments, ischial tuberosity. Yeah, there we go, ischiorectal fossa. So yeah, that area is usually filled in. It's not like that normally. Okay, cool. Right, last video, and then we will we'll finish off next week. So this is it should, it's one of those things where I should have put like a bit of a blank screen before it comes to this. What warning perineum, and I think this is one of the major reasons why we're changing the fibularis muscles away from perineal, because it sounds very similar to perineum, and a strained perineum is very different to strained perineals, but can be, it's like when people say Pacific instead of specific, it just gets mixed up a little bit. But yeah, they're two very distinct areas. So here we go. This is everything in place. So this is the perineum region, which is it's basically your undercarriage. Okay, so it's everything under there is the perineum. There's your ischial tuberosities, sacrotuberous ligaments just there. That there will be the anococcygeal ligament, and then these will be coccygeus and levator ani, filling in the hammock around the side. So there's your coccyx, sacrotuberous, levator ani. So yeah, that's the muscle that we just saw that was connected to that tendinous arch. And then these are the different bits. So the ischiococcygeal part, so from the ischium to the coccyx, pubococcygeal from the pubis to the coccyx, via the ligament though. That's your urogenital hiatus. So basically, this is where everything comes through, basically. So your anus, obviously, at the back. This is a male pelvis, so there'll be an opening at the front for the urethra as well. Yeah, anococcygeal ligament just here, okay, underneath that area there. And then there's the anus put on, and then the anus has got its own muscles, so an external anal sphincter, the scissors that Tristan was talking about earlier. So there's the anus. So now that opening is now filled. This is what it's filled with. So attached to the anococcygeal, and then right at the front there's your urethra. So that's obviously attached to the bladder, and then through to the end of the penis in this particular model. And then female pelvis, obviously a bit wider. Ischial tuberosity just there. There's the anus, levator ani, and then the vagina at the front, with the urethra on top. Ischial tuberosity is just here. There's your sacrotuberous ligaments. So this whole region here, coccyx, ischial tuberosities, all the way to the pubic symphysis, that's your perineum. Okay, so from front to back, like I said before, your kind of undercarriage is your perineum, and then the urogenital triangle, so that's where all of the genitalia are, the urinary tract, and then the anus as well. So the rectum will attach into the anus just there. Brilliant. Right. That went really quick. Really quick. There's an introduction to the pelvic floor. There's a little bit left to do, so we'll do that next week, and then we'll start to. There's a couple of muscles, on the back of the body, just attaching onto the back of the sacrum. So we'll cover some of those as well, and they're the more superficial ones. And then we've covered that whole region then. So we've had a look at the hip, the outside of the hip, the inside of the pelvis, pelvic floor, and then we'll start to work our way up into the lumbar spine. Cool. Hopefully you enjoyed that. And yeah, I enjoyed teaching that one. That was good. And yeah, I'll see some of you on Thursday. We've got a functional movement day, so that'd be really cool. And yeah, start to question some of the things that I was talking about earlier with some of the tests. No problem. I will see you. Oh, yes. I'm away next Monday. I'll be in Germany for the football. So I will be back on the Wednesday. So I've got to do this session on Wednesday at 10 o'clock. next week rather than Monday. Okay, so I'll be traveling back from Germany next week. Cool. See you next week.